Are you looking for the best exercises that you can start doing right now for your sciatica symptoms? I'm Dr. Amy with Physical Therapy for Everybody. Here we are focused on helping people live an active, healthy, and confident lifestyle without pain medication or surgery. And a big part of our goal here is to teach everybody that movement is life. And what we mean by that is that every single tissue in your body requires movement in order to be able to heal correctly. And that includes the nerves. So today we're going to show you a couple of exercises that you can do right now to relieve your sciatica symptoms. And then we're going to discuss some other things that you should keep in mind if you have sciatica pain. All right, so the first exercise we're going to show you is the prone press-up. So the first exercise we're going to do is the prone press-up. So to do this, you want to be laying on the floor. If your floor is a little hard, you may want something like a yoga mat or a Pilates mat to lay on, but if you have carpet, that works just fine. So you're going to lay on your stomach, and then you're going to gently press yourself up just as far as feels comfortable with your back. And I'm going to show you what that can look like, because there's different ways to do it. So I'm going to start laying all the way down with my hands underneath my shoulders. Or you can start with your elbows underneath your shoulders. And then you're going to press up just to the point where you feel comfortable stretch in your low back. Now, as you're doing this, you should feel like that your symptoms are starting to improve. If you do this and you feel like your symptoms are getting worse, this is not the exercise for you. We'll show you another exercise that might work better for you in just a second. Now, if you find that this is good, but you could use a little bit more, go ahead and come on back down, put your hands underneath your shoulders, and then you can arch your back all the way up. Now this can be an aggressive way to start initially. So start with on the elbows first to make sure everything feels okay, and then you can kind of work into this with the arms straight. Again, make sure that this feels better as you're doing it. Your symptoms should be resolving, or they should be, we call it centralizing. So sometimes you'll have symptoms that go up and down, and then as you do this exercise, they'll kind of come back together into one point. That's usually the point where all of your pain is starting from. All right, so start with your elbows first, pressing up. You're just gonna hold that for about 10 to 15 seconds and then lower back down. You can do that multiple times, but you don't want to do it if it starts to increase your symptoms. So I've had some people who can do this maybe 3 to 4 times, but if they do this like 10 or 20 times, it actually increases their symptoms. Again, listen to your body on this. This exercise, this stretch is geared to decreasing your symptoms. So only do as many as you need to decrease your symptoms. However, you can do it regularly throughout the day whenever you feel like your symptoms are really increasing. Now, like I said before, if you find that this is actually increasing your symptoms, then I'm going to have you try the next exercise.